Hello, everyone. This is Dr. Richard Fleming. Today is Thursday, September 10th, 2020. During the last 24 hours, some of you may have been surprised to know that President Trump was aware of the potential danger of COVID-19. As I've been stating since the beginning of this, and other colleagues in the field have also been emphasizing this is a virus that was found in nature and then manipulated by human beings in laboratories. The question is exactly when did Mr. Trump, President Trump, have such information? It is not surprising that a politician, a non-scientist, would attempt to calm the concerns and fears of the public during a period of time that his scientific advisors are attempting to get a handle on this. As I've emphasized, and as Dr. Kevin McCarran in Japan has emphasized, this is a virus that has been man manipulated. There are at least two segments, the insertion of an HIV component and the insertion of a rabies component near the S protein, which makes this virus extremely infective, which means that it's easy to spread from person to person. And it also explains why the simple wearing of masks that are too porous to actually stop a virus have not impacted significantly the transmission of this virus and why we will continue to see it transmitted. The real question here is who knew what and when, and how negligent are they? Is this civil or criminal negligence that we're talking about? With all the PCR numbers about the number of infections that have been documented, it's important to point out that taking the total number of PCR positive tests, the millions that have been reported in the United States and around the world, is not the way to determine the potential death rate from this virus or from any virus for that matter. Simply knowing whether someone is infected does not tell you their outcome. And as I've emphasized, getting a PCR test doesn't tell you what treatment to begin for people. The numbers we have to look at are the number of dead and the number of people who have recovered. Those numbers are the only numbers that we know outcomes of. Everybody else is simply a guess, and we've had more than enough guessing to date. The last numbers I saw showed 20,082,808 individuals who have recovered coronavirus out of the 28 million cases. We have no idea what to make of those that are not listed as recovered or dead. They're somewhere in between, and we can't use them in the calculations. We also know that there are 907,248 deaths. And of course, those numbers are changing daily, hourly, by the minute. We simply don't know what they are. When you compare the number of deaths, the 907,248, and add that to the number recovered, which tells you the total number of people we have answers to, you come up with a 4.3% death rate. We know the virus is more infective than normal viruses because human beings made it so. The reason why these people are dead is because they have not been treated for the inflammation and blood clotting that occurs when they have associated problems that are interfering with their natural immune response, the immune naive and the people with comorbidities. Yesterday was probably a good wake-up call for people, and it would explain why the President of the United States would close borders long before anybody wanted him to. The real question is, why aren't the people involved in the investigation of COVID-19 addressing the inflammation and the blood clotting? The real question is, why aren't the studies being done by the National Institutes of Allergy and Infectious Disease, the National Institutes of Health, the Centers for Disease Control, the Health and Human Services people, and the Public Health Service? Ignore WHO. That's somebody beyond the United States. But the obligation of people in the United States is for the agencies we as taxpayers pay for to do their job. As a reporter put it very succinctly to me yesterday when she was interviewing me, this is really negligence, isn't it? And where I've tried to avoid that approach, it's very clear that it is negligence, intentional or unintentional, civilly or criminally. So let's take a moment and share the screen because I want you to be able to see a patient, um, one of the patients that we have studied, who is a Cuban gentleman. And he was diagnosed by his physician with having COVID-19 symptomatically. At the time he was seen, he was given a PCR nasal swab and started on a hydroxychloroquine and zinc. Over the next 4 days, he didn't do very well, and I'm going to show you a test here in just a moment. Over the next 4 days, he didn't do very well, and he became more short of breath. He originally was somewhat short of breath and had some diminution of smell and was fatigued. Could be any virus, but in this case, with the spread of COVID-19, it was what the primary physician taking care of him looked for. And so he started him on hydroxychloroquine and zinc. 4 days later, when he returned more short of breath and more fatigued, the gentleman was admitted for treatment. He was started on tocilizumab, which is an interleukin 6 inhibitor. He was started on interferon alpha 2 beta, which is a group of drugs that interfere with the replication of viruses. He was started on an Atrovent nebulizer treatment to improve his airway flow. He was started on sub-Q heparin twice a day in an effort to reduce the potential of the blood clotting phenomenon. His interleukin 6 and ferritin levels were elevated, both markers of inflammoThrombotic disease, and he underwent FMT-VDM imaging. What you can see here is the initial results at the day of admission on the left-hand side, and the two primary areas of concern, A and B, show a coronavirus inflammothrombotic pneumonia with the initial evaluation of 170 here and 180 here. Following the 3 days of treatment, the FMT-VDM was repeated, and area A showed a drop in counts to 125 and area B to 128. This information tells us that he was responding successfully to both interferon and interleukin 6 inhibitor treatment, along with bronchodilation and efforts to reduce blood clotting. Prior to the second image, at about 48 hours, he started to report that he was feeling better. And when he was initially brought into the hospital, rather than putting him on a ventilator, he was placed in the prone position on his stomach. 48 hours after coming in with treatment and prone positioning, his symptoms improved. He became less short of breath. They were able to turn him back over onto his back, supine, and continue to monitor him. And the FMT-VDM study, the second one, showed that he was responding favorably to treatment. 8 days after he was admitted, he was discharged. Now, did hydroxychloroquine fail? Hydroxychloroquine and zinc? We don't know. We know it didn't make him better. The question is, did he get started too late? Did it simply not have an effect? Would it have had more of an effect if it would have been combined with interferon, as some studies have indicated? Good questions. But those in power and responsible for doing the research studies really haven't been looking at that. It's dependent upon an independent investigation by myself to even extrapolate that type of information to make it useful. Given the failure of the scientific community from the federal government of the United States and other governments to conduct the type of research necessary to get on top of this inflammothrombotic response that's killing the COVID-19 patients, it falls back to the basic clinicians. And while hydroxychloroquine and zinc didn't help this gentleman, there is a number of individuals who have talked about anecdotal data and the benefits of patients being placed on these drugs. Absent being admitted to the hospital where FMT-BDM can be done and some of these other medications can be started, clinicians seeing patients in the office are left with nothing but anecdotal data. And so while it's not the best thing for them to be using, Dr. Fauci, you really have handcuffed these doctors into limiting what they have available. And a good doctor will do the very best he or she can for their patients in the absence of your being able to provide scientific data. Doctors, keep using the anecdotal information you have. Use the information that I provide here and other publications as they're coming out. Don't give up on your patients and don't treat them with nothing simply because governors and federal agencies don't want you to be using drugs. And don't decide to use a medication because some politician says you should or shouldn't. Keep true to your Hippocratic oath. Treat your patients based upon what information you have and try to make a difference. My effort here is to make you aware of the inflammothrombotic component that you need to be aware of so you can also address your patients in the outpatient setting. This is Dr. Richard Fleming. Today is Thursday, September 10th, and it is a new day for information as we become more and more aware of the ability of this virus to infect person after person, the dangers of not treating the inflammothrombotic response, and the necessity of clinicians to treat their patients given whatever information you have available, be it scientific studies or anecdotal statements. Treat your patients, doctors.